2 महिने झाले हजबंडाक म्हणजे त्याच्या उपरांत माझी तकली खूप दुखोंक लागली म्हणून डॉक्टराक म्हळें दोळ्याच्या तेणी चश्मा दिला. टेन्शना बद्दल तो कितें सांगतलो शेवणो वचोकूच ना. पयलीं खूब टेन्शन जातालें, खूब म्हणजे खूब भरपूर अशें एकटें आसल्या उपरांत खूबच जातालें टेन्शन. कितें जिवूच नाका असो दिसतालो बी, जगोन तरी एकट्या कितें अशें दिसतालें.
Depression is as old a human condition as humankind is. There are parts of rural India where we work where there is still extremely low awareness about depression, both in the community as well as amongst healthcare providers. Much of Sangat's work has really focused on developing models of care through which we can deliver treatments for a range of mental health conditions using non-specialist workers who are based in the community. We call them counsellors, but they're really basically ordinary people who we've recruited from the community, given them training, and essentially asked them to treat people with depression.
Initially, we had taken 40 counsellors. From 40 counsellors, we chose 18. And finally, from 18, we again chose 12. We have assessed them on the commitment, which is seen, the sincerity, the communication skill. These are the main qualities.
So I saw one ads in a paper like they're searching for the counsellors. I don't have any idea about psychological treatment or any other mental illness, and I just simply applied. After getting the training, we came to know that losing appetite, difficulties in sleep, lack of concentration, feeling sad, tired, getting suicidal thoughts in mind, these are the symptoms of depression.
The biggest challenge was how difficult it is for especially women to be able to come to the primary health centre. Public transport is extremely unreliable, so coming for a 45-minute session could take up half of the day. Rather than asking patients to come to where the counsellor sits, we asked ourselves, well, why can't the counsellor go to where the patient is?
कसल्याय गोष्टीन लक्ष दिवपाक त्रास जाला जशी वाचताना टीव्ही पळयतना या 15 दिसांक जाला अशें कितके दीस जाला अशें
4 दीस
4 दीस हे फाटल्या 15 दिसांक काम करपाची आवड किंवा उमेद बीन अशी कमी जाली अशी दिसता. बरें तर पयलीं म्हाका सांगूं शकता की कसली अशी आमी 3 कामां घेतलेली आवड ती करपाची. व्हेरी गुड.
झाडांची आनी व्यायाम.
व्हेरी गुड. बरें म्हाका सांगूं शकता कशा तरेन प्लान केल्लो आमी कितें कितें करपाचें.
टीव्ही पळोवपाची.
ओके.
झाडांची निगा करपाची.
व्हेरी गुड. आनी
व्यायाम.
ओके.
ते घुस फाटलेल्याक जातालें म्हाका जागे सुद्दां आसतना बेश्टेच घुस फाटलेल्याक जातालें म्हणून आंग काडूंक जातालें अशें कितें जाल्ल्या भशेन ते स्वास घेतलेल्याक आतां तितकें जायना. टीव्ही पळोवपाक म्हणजे हांव पयलीं टीव्हीच लायनासलें म्हाका वाज येतालो टीव्ही सुद्दां लावन. मागीर ती 15-15 मिनटांनी टीव्हीचो हें घेतलें न्हू तेन्ना मागीर हांव तें पळोवंक सारकें टायम टू टायम पळोवंक लागलें. तेन्ना मागीर ते प्रोग्रामान सारकें भितून सारकें इंट्रस्टींग पळोवंक लागलें प्रोग्राम.
मूड तुजो हांगासर कितलो आसा? 6 म्हणजे कितें मूड? बरो आसलेलो म्हणजे मध्यमाकून मातसो.
One of the most important critiques of the work that we do is that we have exported a Western way of thinking about mental health. One critique has called it psychiatric imperialism. There is absolutely no reason why a human being should react to misery and unhappiness in a different way if you're in Britain or in India.
कितें अशें जालेलें त्या टायमिंगाचेर मूड तुजो कमी जालो म्हटल्यार?
हजबंडाची म्हाका याद येयली न्हू.
याद कशी येयली तुका?
म्हणून मूड म्हाजो कमी जालो.
ओके. आनी अशें तेन्ना मागीर तूं कितें केलें परत?
म्हणजे म्हाजें अशें धुवप पुसपूच अशेंच काम आसलें. सगळें साफ सफाई केली.
What does differ though is in the way that is understood by the person, and it is extremely important that whatever we do must incorporate those local realities in our approaches. We cannot willy-nilly just translate one model of care to another place. And the best example of us doing that in our program is that we don't use mental health professionals. We use ordinary people in the community to provide mental health care.
आपको भी पता चला कि पेशेंट का मूड जो है 7:30 के उस टाइम पे डाउन रहता है और उसको भी पता है अच्छी तरीके से 7:30 उसका मूड डाउन रहता है. तो मेरे को थोड़ा इधर मेन जो पॉइंट मिसिंग लगा कि उसी टाइम पे जो मूड ऑफ रहता है तो उसका रीज़न क्या है, पेशेंट को थोड़ा डिटेल्स लेनी चाहिए थी, एग्जैक्टली उसी टाइम पे क्या होता है.
Subhash, he's one of the very sincere and committed counselors in Sangat, and whatever is told to him, he just tries to apply it in his counseling. Like if we give him feedback in a particular session, he will try to apply it in the next session, and he will call and tell us like, okay, my session went on well, your feedback was very, very helpful, and that's the reason his dropout rate is also very, very low.
Working with these types of patients is really feeling very good. When the patients say like last 2-3 months I was totally in depressed, but after taking the treatment I am really enjoying my life like before only. So this is we are feeling like more successful. पहिली कितें आसा महत्वाचें पळय हेतून की जे टेन्शनांसून तूं स्वताक भायर काडपाक जो प्रयत्न केला पळय हितून तुजे कश्ट आसा घातलेले, घरातलें काम करप, सगळें रांदप जेवण करप, पण जी टायमीन आमी ह्या सेशनांची आवडटी कामां जी सुरू करता आनी तेका तूं स्पेशल टायम दिता आनी ते टायमानसून तुजी कामां करता पळय तेका लागून तूं आयज बरी जावपाक हांगासर तुजें टेन्शन कमी जावपाक मदत जाल्लेली आसा. फक्त आमी कितें केलां उलोवन तुका एक उलोवन हें केलां तुज्या वांगडा, पूण प्रयत्न तूं केला, हार्डवर्क तूं केला, कश्ट म्हणजे ट्रिटमेंटाचे पयले फळां जें आसा पळय ती पयलीं तुका वयता. People, whenever I meet them outside the bus market, they say hi doctor, hi doctor, hi doctor, like that only. So it is really nice to see, but I'm just constantly saying that I'm not a doctor, I'm just one normal person.
One of the things I found very perplexing is why is it that in countries like in Britain or in the US, where there are many mental health providers, like 10 or 15 times the number than in India or in Africa, still about half of all the people with depression do not receive care. The usual answer has been we don't have enough psychiatrists or psychologists. I don't believe that's the reason. I believe that we really have made mental health care more and more remote from ordinary communities. We use a jargon that is very medicalized. We rob people of their own abilities to help themselves by essentially making them patients. And I think in many ways, the kind of work that you see here is not just changing the way we think about mental health care in these settings, but potentially can reverse engineer our understanding of how mental health care should be delivered even in richly resourced places.
कसले ना कसले तरी असतात मनशांक टेन्शन, खंयचे धंद्याबद्दल कोणाचे जावं कोणाचे आनी कोण एकटे आसता तांकां, जावं भुरगें ना ताका, जावं आपूण सदांच दुयेत आसा. आतां म्हाका अशें सुभाषानूय सांगल्या बद्दल मातशें कशें आसलें जिवनान कितें लायफ बरें घालपाचें अशें म्हणून सांगतात.